Hello everyone, in this video I will explain about proton pump inhibitors. So these are among the most commonly prescribed drugs for reducing gastric acid secretion. They are widely used in conditions such as peptic ulcer disease, GERD, and Zollinger-Ellison syndrome. So before understanding PPI, let's first learn how gastric acid is normally produced. So, when food enters the stomach, three important chemical messengers stimulate acid secretions. There are histamine, gastrin, and acetylcholine. So, these messengers act on the parietal cells of the stomach. Inside the parietal cell, there is an enzyme called the H hydrogen potassium ATPase, also known as the proton pump. This proton pump is responsible for the final step of gastric acid secretions. Once it is activated, the hydrochloric acid is released into the stomach. So normally, gastric acid helps digest food and destroys microorganisms. However, when excessive acid is produced, it damages the stomach lining and may lead to peptic ulcers, GERD, and other acid-related disorders. So to reduce this excessive acid production, we use proton pump inhibitors. So proton pump inhibitors are drugs that irreversibly inhibit the hydrogen potassium ATPase enzyme in the gastric acid parietal cells, thereby producing a profound reduction in gastric acid secretions. So next, mechanism of action. After oral administration, PPI are absorbed from the small intestine because they are entery coated. They reach the gastric parietal cells through the bloodstream. Inside the acidic canaliculi of the parietal cells, they become activated. The activated drugs bind irreversibly to the proton pump and inactivate it. As a result, the final step of acid secretion is blocked, leading to a marked reduction in gastric acid productions. The students remember one important difference: the H2 blockers block the H2 receptors, and proton pump inhibitors block the proton pump itself. Okay? Since the proton pump is the final step in acid secretion, PPI are more effective than H2 blockers. So classifications, there are so many drugs have in the proton pump. There are omeprazole, pantoprazole, esomeprazole, rabeprazole, lansoprazole, dexlansoprazole, and etc. Pharmacokinetic, PP are acid-labeled drugs, so they are formulated as enteric-coated tablet or capsules. They should be taken 30 to 60 minutes before meals, usually before breakfast, so that the proton pumps are active when the drug reaches the stomach. Although the plasma half-life is short, the effect lasts much longer because of the drug irreversibly inhibit the proton pump. Acid secretion returns only after new proton pumps are synthesized. The therapeutic uses are peptic ulcer disease, duodenal ulcer, gastric ulcer, gastroesophageal reflux disease, that means GERD, Zollinger-Ellison syndrome, NSAID-induced ulcers, and as part of Helicobacter pylori eradication therapy. And the common adverse effects are headache, nausea, abdominal pain, diarrhea, and constipation. With prolonged use, possible complications include vitamin B12 deficiency, hypomagnesemia, increased fracture risk, and increased risk of Clostridioides difficile infections. Okay, so omeprazole can inhibit COP to CA19 and may reduce the activation of clopidogrel, potentially decreasing its antiplatelet effect. This interaction should be considered in appropriate clinical settings. So, okay, thank you.